Gut Syndrome by Ishmanpreet Kaur. Factors that influence leaky gut syndrome: infection, dysbiosis, antibiotic and drug, alcohol, diet, and stress. Dysbiosis occurs when bacteria become unbalanced in gastrointestinal tract, and it attributes to several functions such as microbiota related to the regulation of intestinal permeability, including the control of the proliferation of pathogenic bacteria, the stimulation of the immune system, and the production of short-chain fatty acid. Infection can play role in disrupting the intestinal barrier. For example, Helicobacter pylori infects the human stomach. This bacterium is known to increase the intestinal permeability due to the redistribution of the ZO1 protein from the intercellular junctions. Antibiotics and drugs. The gut microbiota can also affected by the antibiotics or other drugs. Different antibiotics have different mode of actions and composition. Antibiotic treatment could increase or decrease the certain species of intestinal microbiota. Alcohol and stress. Alcohol could cause increased intestinal permeability depending on the dose and time of administration of alcohol. Stress can affect the development of intestinal barrier and be associated with the increased gut permeability. Diet. Diet strongly influence the microbial composition and functions of the gut. Diet has a dominant role in the configuration of the intestinal microbiota since dietary compositions can significantly alter gastrointestinal function. Diseases related to intestinal permeability. Inflammatory bowel disease. It involves several chronic diseases. The most common ones are Crohn's disease and ulcerative colitis. Crohn's disease mainly affects the ileum and cecum, whereas ulcerative affects the colon and rectum. Irritable bowel syndrome. It is a digestive disorder which is characterized by frequent abdominal pain related to the shift in the frequency and formation of the bowel action. Many illnesses are being related to dysbiosis of the intestinal microbiota, translocation and dysfunction of the intestinal barrier activity. Out of all of them, we can bold some diseases such as obesity, chronic heart failure, cancer, diabetes, and immune diseases. Non-alcoholic fatty liver disease and non-alcoholic steatohepatitis, changes in gut microbiota composition in NAFLD, patient increase LPS circulation plasma, subsequently triggering inflammation and the plasma LPS and pro-inflammatory cytokines simultaneously increase intestinal permeability. Treatments. Low food map diet. The picture shows which things you should avoid and have in this diet. FODMAP is a fermentable oligo-dimonosaccharides and polyols, which are types of carbohydrates that can cause digestive issues. The low FODMAP diet is a way of identifying and avoiding food that trigger symptoms of irritable bowel syndrome and small intestinal bacterial overgrowth. Pathogenesis of irritable bowel syndrome is also interlinked with intestinal permeability and could be cured with FODMAP. The other treatment is probiotics. The management of probiotics are the maintenance of intestinal integrity, regulations of transit, making of vitamins, fatty acid, indigeneity of non-indigestive fibers, erasing xenobiotics. It could also promote balancing the intestinal permeability, affect the mucus and microbiota. Vitamins in gastrointestinal homeostasis, vitamin plays key role. The main ones are vitamin D and vitamin A. Mucosal barrier component has been affected by these vitamins, including immune system, gut microbiota, and epithelial integrity. Polyphenols, these are present in direct or indirect matter with intestinal permeability by stopping the activity of NFKB, a course recognized as one of the most crucial attributor of cytokines and interleukins and inflammation. Medical herbs. Many plants have been used for medical purposes and have phytochemicals that are organic acid, glycosides, chlorogenic acid, berberines, sesquiterpene, and sesquiterpenoid. These chemicals have been used in curing many diseases, for instance obesity, food allergies, inflammatory bowel diseases, and ulcerative colitis. Mushrooms. These are recognized to pose a crucial function in arteriosclerosis, immunoregulation, anti-tumor activities, and pneumococcal pneumonia. In leaky gut-related diseases, mushroom has been demonstrated to potentially treat pancreatitis, non-alcoholic fatty liver disease, obesity, diabetes, colitis. Example of major treatments like probiotics, food, polyphenol, medical herbs, mushroom. These are some examples which considered as very good in leaky gut syndrome. Lactobacillus, sucrose, quercetin, camellia, it's a tea plant, and shaga mushroom. So these are some food examples, polyphenol examples, medical herb examples, mushroom and probiotics. Here are some references from the same article which I have been reading. Thank you so much for watching.